Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullah. This session represents the two labs that are required in the respiratory system module, the microbiology labs required in the respiratory system modules, and it's going to be two in one. So we're going to talk about, in the first lab, we're going to talk about throat swab and culture, how to collect the throat swab, processing of the throat swab, and the types of culture media required for different types of bacteria which might be present in the throat or the pharynx. The second lab is going to be about sputum sample collection, a procedure, and also the microorganisms which might be present within the sputum, in addition to the culture media which might be used for them. And two swabs need to be collected at the same time from the posterior pharynx, tonsils, or other inflamed area. One is going to be for gram staining and the other is going to be for culture and sensitivity. And the swab should be stored at room temperature and delivered ASAP for the lab to be investigated. So just a bit of a background about the normal flora or the microbiota of the upper respiratory tract. We've already talked about this. So the normal flora might include the strep biogens, strep pneumonia, Haemophilus influenza, and the untypable Haemophilus influenza. Also could include diphtheroids or other microorganisms. We have also the strep pneumonia, Staph aureus also as well from the normal flora. The strep pneumonia, Staph aureus, Klebsiella bacteroides, Corynebacterium diphtheriae, Neisseria gonorrhea, and Bordetella pertussis are some of the common pathogenic bacteria which are seen in the upper respiratory tract infection. So how to perform the procedure of throat swabbing? First of all, we need to wash our hands with soap and water, and then we need to remove the swab from the package and hold it from the tip. After that, we need to ask the patient to tilt his head a little bit backwards, open his mouth open wide, and with the left hand we're having the tongue depressor, so we need to depress his tongue, and with our right hand we need to have the two swabs ready at the same time, and then we ask him to say ah, so that we get rid of the uvula from the way, and then we quickly go into the tonsils, throat, and the posterior pharynx in order to take samples from there. And we should be careful not to touch the tongue or the buccal cavity with the swabs. After that, we need to put the swab into the tube, and then close the tube, and then we need to wash our hands. This procedure needs to be done quickly because most patients would have a gag reflex, and the gag reflex might interfere with this procedure. So you need to be quick and precise. What are the collection guidelines? So for the specimen, it needs to be transported and stored at room temperature, as we said. With the throat, as we said, press the tongue with tongue depressor. We take sample from the posterior pharynx, tonsils, and then we collect two samples, one for gram staining and the other for culture and sensitivity. Should be transported as soon as possible and should be done within less than 24 hours. It's okay to keep it at room temperature since the most common causative microorganism or bacteria of tonsillitis is, as we know, strep biogens, and strep biogens is highly resistant to desiccation. It can tolerate the dry environment up to 3 days. What are the criteria of rejection of the throat swab? If it was transported in an inappropriate device, if it was mislabeled, if it was dried or has been sitting there for more than 3 days, specimen received after prolonged delay, and specimen received in expired transport media. Though, as we said, most of the throat swabs are transported without transport media and should be done as soon as. Specimen processing: the throat swab needs to be collected. Then one of the two throat swabs is going to go to gram staining. The other is going to go to culture and sensitivity, either on blood agar or on chocolate agar. And it needs to be incubated for 24 to 48 hours. After that, it's going to be gram staining. So first we're going to do gram staining, and the gram-positive microorganisms are going to look blue or dark blue or violet, and for the gram-negative they are going to look red. So this is a gram-negative microorganism. This is a gram-positive microorganism. Culture strep biogens is primarily the primary cause of pharyngitis, and most laboratories routinely screen throat cultures for this microorganism. It might be done on sheep blood agar and Columbia agar. So streak and swab across the first quadrant of blood agar plate and using a sterile loop streak to produce isolated colonies. So we start with one corner of the plate, and then after streaking we expose the loop to flame, and then we take the sample for the second quadrant of the plate, then flaming, then third quarter for the plate. And the idea behind that is diluting the amount of the microorganism present in each quadrant of the plate so that we get an isolated colonies. Columbia agar with blood, it has nalidixic acid and cholesterol sulfate, are antimicrobic, suppressing the growth of Enterobacteriaceae and Pseudomonas. Certain gram-negative organisms such as Gardnerella vaginalis and Bacteroides can grow very well in Columbia agar with blood. So this is one type of media that we can use to grow the micro. We need also to stab the media with our loop to increase the hemolysin activity of a group A strep. We can still see it if it's just streaked on the surface of the agar, but it is seen much better when there is stabbing of the agar. So we do both streaking and stabbing with the loop. Another type of media used is streptococcal selective agar, and these are the ingredients of this media. You do not need to memorize all these ingredients. It is selective media for streptococcus. It has crystal violet, trimethoprim sulfamethoxazole, and colistin, which inhibits most types of bacteria. And beta hemolysis can be seen on this type of agar, and it is effective for plating of throat swabs for detection of group A strep. And as we said, bacterial strep is mostly caused by group A or strep biogens, 80 to 90% of the cases. Also, we have direct antigen detection, where we can identify group A streptococcal antigen in throat specimen using different methods, and we're going to talk later on about the rapid detection kits that we have nowadays, which can give us a result within 5 to 10 minutes in the clinic. And the idea behind that is that the streptolysin O, the body forms antibodies against streptolysin O of the strep biogens, and this serologic concept is exploited in the direct antigen detection test, and also in the rapid kits. The first is the most commonly used, which is the lateral flow test, where a sample is taken from the throat of the patient, and then using the rapid strip test seen in here, we add 4 drops from reagent A, then we add 4 drops from reagent B, and after that we put the throat swab into the reagent here. After that we take the strip of the kit and insert it into the solution here, and if the group A strip antigens are present within this solution, they are going to migrate upwards to the strip until they encounter the antibody, specific antibody against the group A strip. So then what we're going to see is what we can see in here. So here the C represents the control. This is to make sure that everything in the procedure is going okay, solutions are okay, and everything is okay, the strip is okay. And then we need to look for this second line. If it gives a faint or a strong line, then this means that this is group A strip positive. In case there is no line at the T or the test, then this is a negative. And if the control is not seen, there is no line representing the control, then there is something wrong with the kit or the strip itself, and this is an invalid test. Also, we have the immunoassay. In the immunoassay, the idea is we take the swab from the throat, and then we add it to a solution where there are specific antibodies against the group A strip. So antigen and antibody get mixed together, and within the strip we have a substrate. So once the strip is inserted, if there's a antigen antibody complex, then the substrate is going to change in color and give us a positive test. This is the newest test. It is somehow expensive in comparison to the lateral flow test. So I also included some of the culture media and pictures and illustrations for the different types of microorganisms in terms of shape of the colony, or what type of media to use for growing them. In addition, some of the characteristics, such as in the strep biogens, we can see that it is beta hemolytic. This is the outline of the differentiation between the gram-positive cocci. We've already covered and talked about, and you need to be familiar, and some questions might come from this graph in the lab as well. Differentiate between beta hemolytic strep. We have the Landsfield classification, we have the bacitracin susceptibility test, we have the CAMP test. This slide represents the bacitracin sensitivity test, and the bacitracin is used to differentiate between the strep biogens and strep agalactia. It is resistant in case of strep biogens, and it is susceptible in case of strep biogens, and resistant in case of strep agalactia. Also, the CAMP test, as we said, we need to streak in the middle with Staph aureus, and then we need to streak with group A perpendicular and group B. And as we see in group B strep, we can see enhancement of zone of hemolysis once it gets into contact with the Staph aureus, and it's seen as the arrowheads. Also, we have the optician test and biosolubility test. The optician test is used to differentiate between strep pneumonia and strep viridans, where strep viridans is resistant and strep pneumonia is sensitive, as we can see in this slide. Also, we have the biosolubility test, which is used to test for strep pneumonia. And strep pneumonia, it produces autolysins in the presence of But if the microorganism is strep viridans, then it's not going to produce autolysins, and then what we're going to see is turbid test tube as seen here. So these tables show how to differentiate between the beta hemolytic and alpha hemolytic streptococci. This is an outline of differentiation between the gram-negative microorganisms you need to familiarize yourself with, and it's divided into bacilli, cocci, and coccobacilli microorganisms. Here we show the Corynebacterium diphtheriae, which can be grown on the potassium tellurite media, and it produces blackish color colonies as seen here, and it requires 24 to 48 hours in order to see those colonies. We have another quick type of culture can be used, which is the Loeffler's serum slope, which produces white creamy colonies, and the results can be seen as early as 6 to 8 hours after inoculation. Also, we have the Bordetella pertussis, where we can use the Bordet Genju agar or the Reagan-Lowy charcoal agar. And on the Reagan-Lowy charcoal agar, it produces these creamy colonies on the charcoal agar. Also, we have the Haemophilus influenza type B, which is grown on chocolate agar, produces these whitish or creamy colonies. And the Moraxilla cataralis can be grown on either the chocolate or broad agar and also produces these whitish colonies. Legionella can be grown on the buffer charcoal yeast extract agar and produces ground glass appearance colonies as seen here. Also, we have the Neisseria gonorrhea, which is grown on the Thyre Martin agar, which is a type of chocolate sheep blood, the chocolate agar, which contain vancomycin, colistin, nystatin, and trimethoprim sulfamethoxazole, and it is used for the isolation of Neisseria gonorrhea with production of these type. So after collection of the specimen, we need to make sure that the patient was not on antibiotic therapy or partially treated, because if the patient took antibiotics before doing the throat swabbing, then the throat swab might come as negative, and this is going to be false negative. We need to make sure that the sample was taken from the right place and the right timing. Too early might not detect, and too late might not detect anything. Also, in the reporting, the gram stain can be the first thing to be reported, and this might lead to narrowing of the possible microorganism. 24 hours to 48 hours later, the sensitivity of the causative microorganism also might be delivered, and based on that you can shift your antibiotic, because we need to put the patient on empirical therapy using broad spectrum antibiotic, and after the results come back we need to shift him to a narrower spectrum antibiotic. A gram stain results should be available within half an hour to an hour. Isolation of the possible microorganism might take 2 to 4 days, and the negative culture will be reported out 1 to 2 days after the receipt of the specimen. So this is all for throat swab. Now we're going to start talking about the second lab for today, which is sputum sample collection and how is it performed. So we're going to talk about the procedure, we're going to talk about the microorganisms which might be involved, and also the media which can be used for isolation of these microorganisms. So what is sputum? Sputum, it's a secretion that's produced in the lungs and the bronchi, also known as phlegm. So when we talk about sputum, then these are products of the lower respiratory tract, and the lower respiratory tract usually is a sterile environment. So sputum production, uh, if it contains microorganisms, then most probably the patient has lower respiratory tract infection. And if the sputum collection was done properly, and then the culture came out with positive results, then we should start the patient on antibiotic if we did not already start him on empirical therapy. But caution should be practiced here so that the sputum comes straight from the lower respiratory tract and not spitted, does not go to the mouth and then after that spit it, because the culture might be contaminated with the oral microbiota or oral flora, and then we might get false positive results. This mucus-like secretion may become infected, blood-stained, or contain abnormal cells that may lead to a diagnosis. Tracheobronchial secretions are an inconsistent mixture of plasma, water, electrolytes, and mucin. So the sputum has all these components together. They pass through the lower and upper respiratory tract, and then they become contaminated with cellular exfoliations, nasal and salivary gland secretions, and normal bacterial flora of the oral cavity. Sputum specimens, they are ordered to identify microorganisms growing in the sputum. So we need to do culture and sensitivity. We need to do gram staining. We might need to do acid-fast staining, and we need to do 3 consecutive sputum sample collection, and usually it's preferred to be done early in the morning. And we can also do cytology testing to see for abnormal cells, and this might be an indicator of cancer as well. And also the cytology, we need to have 3 consecutive samples which are taken early in the morning as well. So sputum collection, how is it done? We have 2 procedures. We have the expectorate procedure and we have the induced procedure. So in the expectorate procedure, we do collection early in the morning under the direct supervision of either the physician or the nurse, and we ask the patient to gargle with water in order to rinse his mouth and get rid of the microorganisms or the normal flora which are present within the oral cavity. And then we ask the patient to take a deep breath and cough forcefully to get rid of the sputum which is present within the lower respiratory tract. And he should have a cup in hand, and directly from the lower respiratory tract he should expectorate into the cup directly, and do not allow the sputum to go to the oral cavity and then being spitted, else otherwise it's going to be contaminated with the oral microbiota. The other way of inducing sputum collection is having the patient to rinse his mouth with water after brushing the gums and the tongue, and after that we provide him with nebulized normal saline in order to increase the content of the lower respiratory tract secretions. And after that we ask him to cough forcefully, and having the cup in hand, then expectorate directly into the cup and send it for testing. So this is the cup with sputum in it, and we can see that it is blood tinged, so it contains blood. Sputum collection need the patient need the night before to drink lots of water, then to be asked to cough deeply and spit any sputum in a sterile cup, and the sputum is then taken to the lab and it is then placed in a special media to allow under conditions that allow the organism to grow. What are the physical properties of sputum? So the appearance, it is liquid, serous. Is it mucoid? Is it purulent? Is it bloody? So this could give us an idea and a clue to where to think and go. Also, the color of the sputum. The normal sputum is either white or colorless. Yellow to green sputum indicate presence of pus and infection within the lungs. Blood in the sputum, we call blood in the sputum hemoptysis or coughing blood, and could be due to lung cancer, TB, lung abscess, or hemorrhage into a small vessel within the lower respiratory tract. Rustic color sputum is an indicative of strep pneumonia infection. Very thick mucus is seen in patients with cystic fibrosis, and those patients are more susceptible to infection with Pseudomonas aeruginosa. Also, we can see parasites in the sputum, and we can think of ascaris as a result. Also, the sputum should not have any odor, but in case of bacterial decomposition, it might lead to a variety of odors. Composition of the sputum, mostly water, and dead cells might be present as well. In pneumonia, what are the causative organisms which can be found in the sputum? We have Moraxilla catarrhalis, which is gram-negative cocci or the diplococci, which are seen in to be attached or residing within the polymorphonuclear cells, and as we can see in this picture, they are gram-negative diplococci. So this is Moraxilla catarrhalis. This represents gram-negative coccobacilli, which is the Haemophilus influenza. This represents a gram-negative bacilli, which is the Klebsiella pneumonia. And here are the colonies of Klebsiella pneumonia on McConkey agar, and the Klebsiella colonies are mucoid type of colonies. Also here what we can see is the Staph aureus. So this is gram-positive cocci. Gram-positive spherical bacteria, which is strep pneumonia, and as you can see, it's a lancet-shaped diplococci. So this is strep pneumonia, and this is the most common type of microorganism where we can see in as a causative of pneumonia. Also, we have other causes such as fungal infections. We can have the Histoplasma capsulatum. Histoplasma capsulatum at 25 degrees is seen in the form of macroconidia, and at 37 degrees it's seen in the form of a yeast. Also, Coxoides ammotis is another fungal infection which can be seen in the lungs, and the Coxoides ammotis can be seen as a mold form regardless of the temperature of incubation, and inside the lung we can see it as in the form of a spherule within the tissues. Also, we have Aspergillus fumigatus, which is another type of fungal infection, and Aspergillus require 1 to 3 weeks for growth, and the colonies begin as dense white mycelium, which later assume a variety of colors according to the different types of Aspergillus species. Also, we have what's called the Ziehl-Neelsen stain, or the acid fast stain, and this is used specifically for the bacteria, Mycobacterium tuberculosis. And as we can see here, the positive Ziehl-Neelsen stain is opposite of the Gram stain, where in the Gram staining we see the Gram positive as violet or dark blue, but here we see the positive as pinkish or reddish. So this is the positive for Mycobacterium tuberculosis. And the Mycobacterium tuberculosis can be grown on Lowenstein gentian media, which is green in color due to the presence of the malachite green in it. And the colonies of the Mycobacterium tuberculosis, as you can see, looks like bread crumbs. Also, there are other culture media which can be used for Mycobacterium tuberculosis, such as Middlebrook 7H10 agar and Middlebrook 7H9 broth, which is a liquid medium. And in this liquid media, the microorganism can be seen, the growth of the microorganism can be seen earlier than the malachite green agar, which might take up to 6 to 8 weeks. Here we can see it as early as 4 to 5 weeks. So this is that's all for lab 1 and lab 2, and thank you for watching.